Welcome to our session on oncology. Great to basically see some new names here. So today we're going to be talking about the skin barrier and consequences of oncology therapy, gut barrier and the gut microbiome and consequences of oncology therapy, and then the risk of infections in cancer therapy. And that will basically give you guys information. I just have to do the standard disclaimer here that the content is for informational educational purposes. It's definitely not intended to replace professional advice. In the case of cancer, it's just really important to have your professional and always seek their advice if you're not sure about using a product, especially when you have a medical condition. And so today what we'll be covering is skin barrier, gut barrier, gut microbiome, and really how they're affected by oncology therapy. And some of our products, will be going through some of our products that basically we've been told by cancer patients in Europe are actually very helpful as they're going through these various therapies. So I think we'll give it one more minute and then we'll get going. And the way that we usually format this is we have some educational videos. And then in between the videos, I'm going to be showing some products. Feel free to give your questions, put your questions in the chat, and we will do our best we can to answer them here. Hi, Lynn, good to see you. Thanks for joining. And Katie and Michael and Joey and Maddie, great to have you. And of course, Nina. All right. So I think we'll just get going. So let's start with the skin barrier. So this is basically a primer. And again, if you have any questions after you hear this primer, just put them in the chat and we'll do the best we can to answer them. Let's start with a basic primer on the skin barrier. The figure here illustrates how the different layers of the skin work together as a physical, chemical, immune, and neural barrier. The top surface is the microbiome. This is the outermost surface and is colonized by the microbiome, that is the normal skin flora, as well as potential pathogens. And how the skin handles these microbes is crucial for its defense. The physical and chemical barrier, called the stratum corneum, is the outer layer of the epidermis and is divided into three sections, the stratum granulosum layers beneath it. The stratum corneum contains tight junctions that seal cells together, limiting entry of pathogens and allergens. The next layer is the chemical response layer, which has antimicrobial peptides to kill or inhibit the bad microbes and natural moisturizing factors that help maintain hydration and barrier integrity. The next layer down is the innate and adaptive immune system, that is the immune barrier. This is found in the stratum spinosus, and across the visible epidermis, the immune cells and mediators are shown. There are Langerhans cells, T cells, cytokines, toll-like receptors, and interleukins, as well as dendritic cells that sense danger and drive inflammation or tolerance. Together, all of these components form the innate and adaptive immune system in the skin. Then there's the neural layer, the cutaneous nerves that give us our neuroimmune interactions. They are shown as yellow structures extending up from the deeper layers of the skin. These nerves can sense stimuli, things like itch, pain, or temperature, and they interact with immune cells, influencing inflammation and itch. Finally, the basal layer and below provides the structural support. The stratum basale is the bottom layer of the epidermis where new keratinocyte skin cells are generated. The basement membrane separates the epidermis from the dermis, and then the dermis, which is much, much thicker than the epidermis, which is about the length of the thickness of the epidermis is about like a human hair, whereas the dermis is much thicker in millimeters. That provides the structural support, blood supply, and a home for many of the immune cells. Overall, the figure shows that the skin barrier is not just the simple wall we see, but a complex layered system where physical structure, chemical defense, immune cells, and nerves all interact to protect the body from microbes and environmental insults. So now what happens when you have a cancer and cancer treatment? Cancer treatments may cause skin and nail changes. These side effects result from impaired skin barrier function and are common with targeted therapies. While skin problems caused by radiation therapy and chemotherapy are often mild, they may be more severe if you're receiving a stem cell transplant, targeted therapy, or immune therapy. You should definitely let your healthcare team know if you notice any skin changes so they can be treated promptly. Radiation therapy can sometimes cause the skin on part of your body receiving radiation to become dry and peel or itch, which is called pruritus, and turn red or darker. Your skin may look sunburned or become swollen and puffy. You may develop sores that become painful, wet, or infected. This is called a moist reaction. If you received radiation therapy in the past, the area of skin where you received radiation may also become red, blister, peel, or hurt, which is called radiation recall when you have chemotherapy. Now, some types of chemotherapy can cause your skin also to become dry, itchy, red, darker, or peel. You may develop a minor rash like acne or measles looking, or peeling particularly on the face, chest, and hands. You may also sunburn easily, which is called photosensitivity. Some people also have significant skin pigmentation changes. Their skin becomes lighter, which is called hypopigmentation, or darker, called hyperpigmentation. Signs of an allergic response to chemo may include a sudden severe rash or hives or burning sensation, and this must be reported to your medical team immediately. Your nails too may be affected and become brittle, develop ridges, or look dark and cracked. Your cuticles may hurt. And then there's hand-foot syndrome. Specific toxicity characterized by redness, pain, swelling, and blisters on the palms of hands and soles of feet, as well as hair loss, which we all know about, alopecia, which, while not technically being your skin, basically affects your hair follicles that are severely affected, which leads to hair loss on the head and on the body. Stem cell transplants can cause graft versus host disease, which may cause severe skin problems such as severe rashes, blistering, or thickening of the skin. Some types of immune therapy can cause a severe and sometimes extensive rash. Again, your skin may be dry or blister, and some types of targeted therapy may also cause dry skin rashes and nail problems. Now let's review ways to prevent or manage mild skin and nail changes during cancer treatment. The first point is to talk with your healthcare team and learn if you should manage these problems at home. Depending on the treatment you are receiving, your healthcare team may advise to take these steps. They may recommend certain skin products, such as mild soaps that are gentle on your skin. Or if you're receiving radiation therapy, you can ask about skin products such as powders or antiperspirants that you should avoid before using the treatment, such as products containing aluminum. In order to prevent infections, because radiation therapy can cause the skin to blister in the treatment area and to peel, become painful and wet, which often happens in areas like skin folds or around your ears, breasts, or bottom. So trying to keep that area clean and dry so it doesn't become infected, and we'll talk about staph later, is really important. Your nurse will probably talk with you about how to clean the area and may prescribe special dressings that you can apply to the area with or without antibiotics. Overall, though, moisturizing your skin is critical. So using creams and lotions that prevent your skin from becoming dry and itchy, so that skin does not become infected or crack, and using special creams or ointments for severely dry, itchy, or painful skin is important. And protecting your skin with sunscreen. We talked about photosensitivity and also sun protective lip balm. Or if that is too much for your skin, wearing loose-fitting long-sleeve shirts and pants and a hat with a wide brim when outdoors to prevent sunburn because of the photosensitivity. And especially if you're getting radiation therapy, don't use heating pads, ice packs, or bandages on the treatment area. You may also want to shave less often or use an electric razor, or stop shaving if your skin becomes tender and sore. How to prevent and treat dry, itchy skin? Well, first of all, avoiding products that list alcohol or fragrance as an ingredient, since they dry and irritate your skin. You may also look at products containing colloidal oatmeal, as it can reduce itching, as well as, like in eczema, taking shorter showers or baths in lukewarm, not hot water, and then immediately putting the skin cream or ointment on right after drying off from the shower, but while your skin is still a little damp. You can also apply cool washcloths or ice to dry the itchy skin. It's very, very similar to eczema, actually. And for minor nail problems, the key is to keep your nails clean and cut to avoid accidentally tearing them, and protecting your hands and nails by wearing gloves when you wash the dishes or cleaning the house, for example, because household cleansers and dishwasher fluids can be fairly toxic for people with a skin barrier issue. Also avoiding getting manicures and pedicures with nail polish, and not wearing tight-fitting shoes so that your feet don't sweat too much. Again, your nurse will be able to recommend products that can be used to treat nail problems. Learning about treatments for irritating or painful skin rashes is also important because some skin problems may need immediate medical treatment, especially infections. Some doctors may give you a limited time medicated cream, such as a topical corticosteroid. Don't use those for more than a couple days and then talk to your doctor again, or antibiotics or oral corticosteroids that you may take as a pill. In terms of ingredients, things to look for and avoid, fragrance or perfume, because these trigger allergic reactions and can lead to nausea, which is common in people with oncology treatment using scented products. Ethanol that we talked about, because this strips moisture, causing extreme dryness. Sulfates like sodium lauryl sulfate, because these harsh detergents damage the skin barrier further. Parabens and phthalates, which are preservatives and plasticizers, which have been suspected of being endocrine disruptors. Retinoids and retinoic acids, because these are very harsh and drying on a weak skin barrier. Chemical exfoliants like AHAs and BHAs, because again, glycolic or salicylic acids can damage fragile skin. And aluminum that we talked about in deodorants, especially in areas receiving radiation if you're getting them in your armpits. And finally, formaldehyde releasing preservatives like DMDM hydantoin, because these cause cancer. All right, so then I guess the question is, what can you use? And we're going to give you some of our recommendations. And as I said earlier, definitely always check with your provider if the ingredients are okay and if everything basically is compatible with any allergies that you might have. So what we'll start with is simple washing. You'll see on the right-hand side where we have some potential products, there's a washi glove. This is actually from Germany. It's made in Germany. It's a special fabric that's designed to be super soft. There's one side that is exfoliating, very, very gently exfoliating. Another side which is just super soft for wiping off dirt and grime. And if your skin is hypersensitized, you can just start with water. So you basically use the washi glove. You can see there's 2 holes in it, right-handed, left-handed. You slip your thumb through it, and basically you use that to wash face, body, affected areas, unaffected areas with just water. Once your skin improves a little bit, we recommend basically removing dirt and grime as well as harmful bacteria with our unscented soap. Now you might be wondering, well, why is the soap so special? Basically, it helps clean and protect your skin without stripping moisture or your microbiome. We want to preserve your microbiome in all instances, because the last thing you want is to get some kind of pathogen or bad bacteria on your skin, which can cause an infection, especially when the skin barrier is weak, because your immune system is already compromised because you're going through the oncology treatment, especially with immunotherapy or chemotherapy. And so you really want to protect your body from any type of potential issue or sepsis. So basically, the issue with prolonged use of soaps and surfactants is their negative impact on the skin barrier. Basically, you have these lipids that we talked about in the skin barrier. So basically, these fats that are in your skin that help seal the skin together. They're like the mortar. And then they can also denature proteins, which increases in the transepidermal water loss. So that's basically the water that you're losing through your skin barrier, which makes your skin dry. And that then also affects the permeability or making your skin leaky. If you have basically a surfactant-based type soap, like a cleansing bar, so cleansing bar is not soap, then the surfactants there basically can, in addition, alter the surface chemistry and the pH of your skin, which then changes the microbiome. And certain bacteria basically have also been linked to higher growth. So if your pH of your skin becomes more alkaline, normally it's somewhere between 4.5 and 5.5, typically like 4.7 to 5.2. And if it gets too alkaline, then basically that displaces the normal skin microbiome. So it's really important to not strip this microbiome, but also to have a soap that has a lot of the essential fatty acids so that it doesn't strip the lipids and the ceramides from the skin. So this soap basically is made with shea butter, which is very gentle cocoa butter, olive oil, which is rich in basically antioxidants and vitamins and is also a great moisturizer. Calendula, which not only moisturizes, but also soothes and helps protect the skin. And carrots, with beta carotene, that the skin is actually made with carrot puree, which the skin can convert into vitamin A to support the immune system. Basically, this soap, what you'll find is it's a little bit on the slimy side, even when it's dry, and that's because it has over 30% glycerin. That's probably about the highest content of glycerin that you can leave in a soap. Many soap makers strip the glycerin out and sell it to the food industry because they pay a high price to put it into as a food additive. We basically add extra shea butter and cocoa butter into the soap when it's being made, and that causes what we call super fats. So there's not only the fats from the butters that are left in the soap, but there's a complete conversion through the sodium hydroxide process, through the saponification process, into glycerin. So it's super, super gentle on your skin and your microbiome. So that's kind of for washing, body and face. If you want something even more gentle for your face, that's also very skin barrier protecting, or you need something to remove makeup with, then again, on the right-hand side, we have the Be a Gentle Cleansing Oil. It's kind of right in the middle of the 3x3 grid, if we were playing tic-tac-toe. And that basically has natural plant oils like borage oil and plum kernel oil and jojoba oil. So it's essentially, again, designed to be as soothing as possible, as skin barrier supporting as possible, so that you can still wear makeup if you, makeup makes us feel better, especially when we're going through something traumatic. And so you have a very gentle way to remove it, including mascara, and it's really easy on the eyes. So then the next kind of product, since I mentioned colloidal oatmeal, is our eczema relief lotion, which actually, if you look at the dermatitis that's induced either by radiation or during chemotherapy, is very, very similar to eczema. And so the functions of this product are actually very relevant to people undergoing an oncology treatment. This was designed to soothe, very deeply hydrate, since we were talking about dry skin, and repair the skin barrier. So actively repair the skin barrier and help skin cell turnover so that you don't have that dry, flaky skin. One of the main functions, as we talked about during oncology treatment, is that your epidermis, your skin, has water loss. And so it's losing water, so you want to be able to maintain that hydration. And so cosmetically dry skin, if you kind of feel that it's dry or it's pulling, that usually means that you have a weaker barrier. So you also don't want that squeaky clean feeling after you wash. And so this then basically disrupts the cohesion of your skin cells, which makes your skin barrier more leaky. And also you can strip these natural moisturization factors, like we talked about, these lipids from the skin, if you're using harsh cleansers. And so that will further impair your barrier function. And so what we really want to do is not only soothe the irritation of the skin, reduce the redness of that skin, but also reduce that roughness, unevenness, flakiness, or cracks and fissures in the skin. And we want to definitely reduce itch. So this basically has comfrey, which contains allantoin, which is great at reducing itch. And then we want to basically eliminate that dryness. And so this has a couple different things. It has obviously hyaluronic acid to rehydrate the skin and improve moisture retention, and ceramides, natural skin ceramides, to fortify that skin barrier kind of instantly on application. One of the things you'll find is this lotion, it's not a thick cream, and it's designed to penetrate, okay? And then Dr. Cutler, I'll get to your questions. And then it also has basically our Bia complex, which comprises calendula, which is a great anti-inflammatory plant. The comfrey oil I mentioned with the allantoin to soothe the itch, but also comfrey helps you shed those dry dead skin layers, because if you have dead skin layers that are dry, the topical, your cream won't penetrate through the skin to hydrate it. And then it also has this really cool plant from Bulgaria called Haberleia. And I should mention that all of these ingredients are biotech plant cell extracts, which is very rich in myconoside. And why is myconoside important? It basically helps protect the skin from oxidative stress, and it helps increase elasticity. And lastly, it has a brown algae from the Mediterranean called Podina pavonica. It's basically this brown macroalgae, and that's a humectant that stimulates hyaluronic acid production. So that actually helps your skin retain moisture. It stimulates a gene called aquaporin that basically is the pathway to producing hyaluronic acid, and so that really helps moisturize, soften dry, flaky skin. And the calendula, comfrey, and haberlea, actually the comfrey helps stimulate your filaggrin, involucrin, and loricrin genes. These are the proteins that are the structural, that gives structure to your skin. So in fact, they help you repair the skin much faster. So going back to the questions, in terms of skin concerns with most immune checkpoint inhibitors for malignant melanoma, so here I'm talking more about breast cancer or intestinal cancer or leukemias. For malignant melanoma, usually there's surgery. So there's Mohs surgery to cut it out, and there's either follow-on radiation or chemotherapy to get rid of potentially any cells that may have metastasized or that may have not been removed in the surgery. So I would say definitely those zones have to be treated very differently. You just can't immediately wash them with water, wash them with soap. There you have to follow essentially what the dermatologist or the oncologist is telling you to do. This would be more once the skin has grown back, because you will have an open wound when they remove that, and also depending on the depth of which they remove it. And so in terms of the immunity check for malignant melanoma, I mean, we all know how it forms. We kind of know that it kind of looks uneven in color, blackish, brownish, with jagged edges, as opposed to freckles or other types of kind of normal skin hyperpigmentation areas. Melanoma is a different case because you are actually directly treating the skin. So there again, I would ask the professional, because the last thing you want is for it to interfere with the treatment. And when we talk about gut and supplements, we'll talk about, for example, some things that do interfere with the treatments, like probiotics, where you have to be incredibly careful. So in the case of melanoma, we don't want the topicals to interfere with that treatment. But that's an excellent question. And just so you guys can see, this is kind of the drippy, what we basically do with products to kind of show you how it flows. So it's not a thick cream. It'll basically flow very naturally. And then you will see it smells a little bit like cedar wood. The cedar wood is there also as an antibacterial. You'll see that it absorbs very, very rapidly. And I'm right now in Canada where it's super cold, so my hands are dry. So you can pretty much see, I rub my hands together a couple times and it's in my skin. And it's not greasy at all. So what's nice about it is the moment you apply it, it absorbs. If your skin is that dry, it will pretty much absorb immediately. Now, if your skin is cracked, there may be, it's because the plant actives are at a 1% or 2% level in this formulation, depending on the severity of the dryness and the crackness, it might burn a couple times. Again, so do corticosteroids, so do JAK inhibitors on the site of application. So again, just beware. And in that case, you may want to go to something that's more gentle to start off with. And that would be, for example, our oil. So that's in the middle row on the very right. And this is basically our facial oil, and it is anhydrous. So there's no preservative system in there. And this is based on almond oil. So you also want to make sure you don't have a tree nut allergy. We're working actually on an eczema equivalent that has sunflower oil. And this basically will lock in moisture in an extremely dry, extremely compromised skin barrier. Basically this has rosehip oil, bog myrtle, sea buckthorn. The goal of this is to deliver pretty much all the essential minerals and vitamins to your skin, along with fatty acids and all the essential omegas, so that you can fill in those lipids, especially if they're missing. And the ceramides actually come from natural plant oils, which are organic. So basically this is kind of, if you're really, really bad shape, this would be your first line of defense. If you're kind of in mild to moderate bad shape, you can start directly with the lotion. You can also mix the two together. I'll just quickly show you the oil. So the oil is pretty much yellow. So you'll see the sea buckthorn. So you can kind of see there it goes. And again, it's a thin, rapidly absorbing oil. It also has baobab seed oil and kiwi seed oil. And then it has rosemary. Why rosemary? Kind of smells like salad dressing because rosemary is great for anti-staph. So rosmarinic acid actually has been shown in inhibition studies to actually be pretty potent preventing staph. So again, we're not killing staph here. We'll talk about that later. What we're trying to do is prevent colonization. So again, through something that's super, super gentle and can be used on a compromised skin barrier. So, you know, now my hands look really hydrated. So when we move further down, there's one more product that I'll talk about before we talk about staph and infections, and that is the Kung Fu Recovery Gel. So this is one of our new products. So this was actually designed specifically for recovery, recovery post-radiation, recovery post-UV, recovery post-laser. So it can be used either, you know, from a cosmetics perspective, things like micro damage for microneedling or pulse laser therapy. But more importantly, it's great for sunburns because, as you know, you'll have photosensitivity. So again, sunscreen is going to be incredibly important when you're undergoing any cancer treatment or just wearing, you know, wide brim hats and clothes that are loose fitting so that you're not exposed to the sun or going out, you know, definitely not during kind of the core hours of the sunshine, you know, especially like 11 to 2 p.m. during the summertime. But basically, this is specifically designed to help skin post-treatment recover. So for example, if you have breast cancer and you have specific localized radiation, it's actually great to apply before and after to protect the skin. Many people have skin turning blackish after the radiation treatment because that's basically direct injury, like your skin is collateral damage, again, because it turns over so quickly relative to other parts of your body. And so the epidermal cells and the connecting tissues basically get highly inflamed. This disrupts the skin barrier turnover cycle. And so the issue is that radiation and these other types of chemotherapies, they reduce the skin cell proliferation. They also impair the production of lipids, these ceramides, which is another trigger for this transepidermal water loss. Agents and immune therapies, you know, also can create these inflammatory rashes that are red and incredibly painful, which further weakens the skin barrier. And so basically, weaker skin barrier, higher risk of infection, delayed healing, heightened sensitivity to any kind of irritant, which is why we're talking about no perfumes, no alcohol, no sulfates, etc. And so it's important to basically soothe this as quickly as possible to reduce that redness, reduce that inflammation, bring in the right antioxidants, rehydrate this dry skin very quickly, but protect the skin cells from becoming, I would call it unintended collateral damage in the killing process of the tumor cells. So in the war against the cancer, you don't want your skin, and we'll talk about the gut, to be essentially the collateral damage. And so how does this thing work? And then I'll show you kind of what it feels like and what it looks like. So it actually has the Kung Fu complex. Kung Fu basically means healing in traditional Chinese, and it's a combination of 3 traditional Chinese medicine plants, so TCM, and a marine algae. And what it does is it increases your antioxidant defenses. So in fact, it protects your antioxidant enzymes and proteins so that they can work right after the radiation. So it protects them by up to 70%. So you can see kind of in that antioxidant curative effect, it protects your catalase, it protects your SOD. These are the antioxidant enzymes that you naturally want to protect and boost. It improves cell survival, so reduces what's called cell apoptosis. It helps protect your DNA and repair your DNA. And it helps really propel and accelerate this extracellular matrix remodeling of the skin barrier. What that really means is healing. Basically how the cells move around to heal whatever part is burned or wherever there's a hole, and to essentially make your wound healing more efficient while reducing redness. Then in here, there's also our Onto complex, which is basically an antioxidant collection, and that's a combination of hyaluronic acid, so back to the hydration, for hydrating, soothing, and calming, but also there's a very powerful antioxidant mix from 3 plants from Patagonia that we discovered, Maqui, Matico, and Morta. And that alleviates not only the temporary redness, but that also really helps with the healing process. And then there's ground cherry. I don't know if some of you might have bought it at the store to eat. They're these little yellow fruits. It's also kind of where some of this color comes from for the packaging. They've been used for centuries all around the world for wound healing because it's very rich in vitamin C and other antioxidants like anthocyanins. And so that helps get rid of the free radical damage that might be generated in your skin from the oncology treatment, but also reduce redness, promote collagen production because you need collagen in order to heal, and also improve the skin tone. We talked about the hyperpigmentation. So this is one way to start minimizing the hyperpigmentation. And then we have milk thistle ester in here. That's an incredibly soothing and redness reducing ingredient. And finally, more butter, which creates a protective film on the outside of your skin. So again, we're trying to prevent dehydration. We're trying to prevent this transepidermal water loss. What this product looks like, it's kind of a gel. It's actually cooling on contact. It's really cool. This formulation actually does feel cold. If you want extra soothing, you basically put it in the fridge. I think my son stole this one and used it all up before the podcast. So there we go. So again, it kind of all of our products. So first of all, none of them are pure white, and that's because we don't use any kind of bleaching agent in our product. So whatever the plant extract colors give it, it may be slightly brownish, slightly pinkish, but basically this spreads very, very lightly. So this is an incredibly light gel. Again, if you have skin that's incredibly dry or burned, it will pretty much absorb very, very quickly. It's also used by people with topical steroid withdrawal syndrome. And as I mentioned, people post-procedure where, you've completely microneedled your face or, RF needled your face or, burn parts of your face off with a laser to try to re-stimulate the collagen. But you can see it pretty much absorbs very quickly, and then it forms, you'll feel this kind of very thin film on your skin, which is locking that moisture in. So this would be, for example, the first thing you would put on, obviously clearing it with your oncologist right after radiation therapy. Or if you're out in the sun and you forgot to put on sunscreen and you have the photosensitivity from chemotherapy, this would be the first thing you would put on as a treatment for that condition. So that's kind of our overview of the skincare portion. And now we'll go to infections, and I'm going to play you a little video about staph, specifically Staph aureus. There's different kinds of Staphylococcus on our skin. Some of them are benign, like Staph epidermidis, which produces butyrate, feeds our skin cells, keeps the tight junctions, hominis, mitis. But there's one that's not so great, and that's Staph aureus. Staphylococcus bacterium is a gram-positive, spherically shaped bacterium that is a normal part of our human flora. It's on your skin and inside your nose. In a balanced microbiome, it is normally benign. About 30% of people on average are colonized by S. aureus. But, interestingly, 10% of healthy people are colonized, but 80% of those with eczema or cancer treatment can be disproportionately colonized. When S. aureus populations increase in microbiome imbalance, that is dysbiosis, they can form biofilms that are even harder to kill and can lead to severe infections. If the skin barrier is compromised and leaky, like during cancer therapy, the bacterium can enter the bloodstream where it can become truly dangerous. Even more dangerous are strains of Staph aureus that are resistant to antibiotics like MRSA, methicillin-resistant S. aureus. An S. aureus infection typically starts as red bumps or red streaks that can evolve into sores, pus-filled blisters, or yellow-colored crusts. For those undergoing cancer therapy, these infections can lead to severe itch, which leads to scratching, bleeding, and a higher risk of not only spreading the infection through the fingernails, but into the bloodstream. Now, what are some key aspects of S. aureus in cancer care, and what do you have to look out for? First of all, S. aureus infections induce high-risk factors. Because people undergoing oncology treatments are on immune-suppressing either chemotherapy, radiation, with frequent hospitalizations, they are at increased vulnerability. Common infections. S. aureus accounts for about 1.3 to 12% of bacteremia cases in cancer patients, with high rates of skin or soft tissue infections, about 26.7%, as well as pneumonia. When it gets to the lungs, 25%. The bigger issue is the mortality and resistance issue with methicillin-resistant SRAS or MRSA, because this poses a high mortality risk with a 30-day mortality for pneumonia or bacteremia approaching about 50% in some studies. And this also has significant treatment challenges because there are high treatment failure rates. One study reported up to 52% occurring with vancomycin, which sometimes necessitates alternative interventions. So the key here is prevention. Stringent infection control is absolutely crucial, as the bacteria often colonize the skin and mucous membranes like the nose of the patients. So treating yourself on a regular basis to make sure you don't get an infection is the first line of defense. And why is this particularly important? Well, drug resistance. In some cancers, not all, but for example, patients with Sézary syndrome, which is a leukemic variant of cutaneous T-cell lymphoma, these patients are prone to Staph aureus infections and have a poor prognosis due to treatment resistance. Papers, for example, the one that I'm showing the figure for, show that the S. aureus and staphylococcal enterotoxins, these are basically the toxins produced by the bacterium, can induce drug resistance in the malignant T cells against the therapeutics commonly used. So staph can be particularly dangerous for people undergoing oncology treatment or with certain types of cancers. All right, so what do we do about it? So if you go to the kind of bottom row middle, you will see the BioBiome gel. And the reason we have a 3-pack is if we're eliminating the staph, we want to absolutely completely eliminate it. And what this is, it's actually cold, so it will ship to you cold. And this is a 2-day dose. So this is 5 milliliters of our Biome Reset gel. And what this is, it's a lightweight gel, and it delivers anti-staph actives to rebalance your skin microbiome, but also to soothe. So there's 2 core ingredients in here. And I should mention before that, basically, there's 100% reduction in many of the Staph aureus strains. Most of the strains, basically 92%, are significantly reduced, and this was done basically in Petri dish demonstrations. And then it also can rebalance and kill about 17 strains of this MRSA. So it's actually very good at killing staph. There's 2 main components in it. It doesn't actually have that many components, and that's the phage lysate. So basically, this is what provides the antibacterial activity to rebalance it and also soothe the irritation and reduce the itch. And then we've also added niacinamide or vitamin B3, because this helps re-strengthen the skin barrier, and it also helps its ability to retain moisture and reduce water loss. So all of that basically to reduce the dryness, to reduce the itch, but it also is a great anti-inflammatory for the redness and irritation. And so basically you would use one of these over 2 days. First, you would cleanse your skin thoroughly, pat it dry, and then you would basically apply this to the area you think is affected, or, you know, for example, the treatment area. If you're undergoing radiation, you allow it to dry for 10 to 15 minutes. That allows the phage lysate to start doing its thing, and then you rinse it off with water. It's important to avoid products with acids for 48 hours. Now, you shouldn't really be using AHA, BHA, or acid products anyway, because your skin barrier is compromised. And then you basically repeat it with the second dose on day 2. And the reason we have 3 doses is this kind of allows you, with a break in between, to do this over a 1-week period, because we want to make sure staph is really good at making these films. So like it kind of piles up on each other and forms these colonies that are called biofilms. And sometimes you need to strip away, you know, that biofilm can become quite thick. So you can think of it as like removing bricks from a wall, layer by layer by layer, to get rid of the wall. So that's why we have a 3-pack. You can also, you know, if you only need 1, you keep it in the fridge, and that way you have it there for emergency. So it can be used in different ways. It can also be used, you can use 1 kind of for maintenance once a month. If you don't think you have any issues or risks for staph, definitely don't freeze this. And this is basically an airless pump. So you just press down on it, and you will see it's basically a clear gel. So you can see it's like this clear, colorless gel, and you basically apply it to whatever surface of the skin. And also, if you look at the top line, we have this applicator, And the applicator is essentially what we use for the so that you don't touch your hands. The other thing I should mention about staph, it's important to kind of, if you do suspect you have an area with staph, to not spread it. It's really easy to spread staph. And by the way, we all have staph in our noses. So sometimes that's how we can spread staph infections, is they can come down from our nose. But with this applicator, first of all, you can wash it with soapy water. You can also put it in the dishwasher if you want extra sanitization, and it's touchless. So you would basically put the gel on the applicator and use the applicator, and then wash it off. And then you wash the applicator. So that way you're pretty sure that there's no contact with your hands and you're not going to spread the stuff from one area to another. And then in terms of the killing, basically it's incredibly good at getting rid of the staph. And so it doesn't kill anything. What I should also mention is, because there are other beneficial types of staph bacteria, right? The epidermidis and hominis and mitis and capitis, you don't want to kill those off. So this is highly, highly selective. That lysate has been developed. It's actually a cocktail of different phage lysates. It's been developed specifically to kill Staph aureus and no other kind of staph. So it kills the bad staph and not the good staph. And then in between, again, if you're still itchy or you kind of have that irritated, itchy skin that's sensitive, we actually have a salt soap. And this is actually not meant for the bathtub. This is actually, it's not that you basically just need 1 or 2 teaspoons of this. And this contains Epsom and sea salts. But it also has oat seed oil and jojoba oil, which are moisturizing, chickweed, which has been known for centuries in Ireland to reduce itch and irritation. It's an amazing antioxidant, and gotu kola, which is used in Ayurvedic medicine as well for reduction of itch. And so basically, when we tested the salt wrap, we had 0% allergic reactions on people with sensitive skin. And we basically had 0% redness generation, and 100% of the test subjects basically felt that they got a soothing kind of, basically a soothing thing. And the way you'd use it is basically, so you mix it up. So you take a couple teaspoons or 1 tablespoon in basically a big bowl of water. You mix it up, and then you take gauze, and you soak the gauze. You wrap the gauze around the affected area. Or you make like a gauze pad that you put on the affected area, and then usually you wrap another set of gauze around it, kind of like a dry layer, and you leave it on for 15 to 20 minutes, and then you rinse it off again. And that basically also helps prevent additional bacterial colonization. So keeping everything clean, keeping everything soothed, and mostly scratching, right? When you start scratching, you start creating cracks, fissures, you start damaging the skin barrier. Now your skin is compromised, because sometimes if it's weak with the scratching, you get bleeding. That's the last thing you want, because then you're again exposing your skin to potential infection. So that's basically the skin piece of this live. And now we're going to move to the gut, because the gut is just as important as the skin. And as we'll see, in fact, it's a larger surface area of contact to the outside world, and it is also tremendously affected by oncology treatments. It is the largest contact site in the human body. Its area is about 100 square feet. The skin has a much smaller surface area at about 15 to 20 square feet. The gut, like the skin, forms a barrier critical for survival. Studying the structure and contents of these 2 barriers is a holistic way to understand the importance and effect of changes to their microbiomes. Gut and skin are more alike than we expect. The gut barrier, like the skin barrier, protects against passage by toxins, pathogens, and pollution, while allowing, unlike skin, the transport of essential nutrients and fluids. The intestinal and skin barriers both have 4 sublayers: the microbial barrier, the biochemical barrier, the physical barrier, and the immune barrier. The microbial barrier is comprised of the microbiota and their metabolically active byproducts. In the skin, these bacteria maintain skin balance by regulating pH and barrier function, and also notify the immune system of potential invaders. In the gut, commensal bacteria help by digesting food components and nutrients and making vitamins and competing with pathogens. In the skin, the chemical barrier is mainly due to natural moisturizing factors and epidermal lipids in the stratum corneum. In the gut, the chemical barrier is the mucosal layer with its mucins, glycoproteins, antibodies, and antimicrobial elements that are produced by the gut microbiome. The mucosal layer sits as a coating on the colonic epithelial cells, forming a protective layer. In skin, the physical barrier is accomplished thanks to tight junctions and desmosomes in the granular and spinous layers. The cells that form the barrier are called corneocytes. The skin barrier in an adult turns over in about 3 to 4 weeks. In the gut, the epithelial cells themselves form the physical barrier. This layer of cells includes enterocytes, goblet cells, Paneth cells, enteroendocrine cells, M cells, and intestinal stem cells. These cells turn over much faster, every 3 to 5 days, which is why the gut is more affected by oncology treatments. In skin, the immune barrier is carried on by skin-resident immune cells in the epidermis and dermis, like the Langerhans, dermal dendritic cells, macrophages, T cells, mast cells, and epidermal keratinocytes. The gut immune barrier is partially comprised of gut-assisted lymphoid tissue called GALT in the intestinal wall. This is the first line of defense of the intestinal barrier, along with the secretory immunoglobulins like IgA, IgE, IgG, and IgM. IgA is the primary antibody in the intestinal mucosa and is often measured as an indicator of intestinal immunity, such as in our gut microbiome test. Now, in chemotherapy, there's a clear analogy between the gut and the skin. So both are densely vascularized and play crucial immune and neuroendocrine roles. Additionally, while the skin is the barrier between our bodies and the external world, the intestinal barrier is the barrier between our bodies and the vast array of organisms with which we have a symbiotic existence and need to produce our nutrition. The gut microbiome, or the balance of bacteria in the gut, can have significant impact on skin health. The gut and skin are in constant communication through the gut-skin axis, and an imbalance in the gut microbiome can lead to inflammatory skin conditions such as dermatitis. The gut-skin axis is the two-way communication between the gut microbiome and the skin. It's important to emphasize that two-way here means truly bidirectional. The gut can influence the skin, but the skin can also influence the gut. An example of the less frequently mentioned direction is the production of vitamin D. Human skin creates vitamin D in response to exposure to UVB light, and this circulating vitamin D is known to enhance gut microbiome diversity. And this can be particularly difficult, for example, if you're undergoing radiation therapy and can't go outside. Oncology treatments, particularly chemotherapy and radiation, frequently lead to intestinal mucositis, leading to a breakdown of the gut barrier, the epithelial cells, and increased permeability, which we call leaky gut, as well as damage to the protective mucus layer. These treatments also kill fast-growing gut cells, causing inflammation, bacterial translocation, that means the bacteria get into your bloodstream, nutrient malabsorption, and often fuel systemic inflammation. We still need a better understanding of the relationship between the above processes, but there's a lot of research in this area. For example, this is why skin is affected by oncology treatments. It's hard to distinguish between the inside-out and outside-in root causes. It is more than likely that the bidirectionality means that the root cause is both inside and outside simultaneously, which means that the best management of skin gut issues during oncology treatment actually requires an inside and outside approach at the same time. This is why understanding the gut microbiome of those suffering from side effects of chemotherapy is so important, and why prebiotics may help improve skin health by regulating the gut-skin axis, by balancing the gut microbiome without the risk of translocation of probiotics through a weakened gut barrier. Now, oncology treatments, particularly chemoradiation and immunotherapy, profoundly disrupt the gut microbiome, which is called dysbiosis, and compromise the intestinal barriers we just heard, causing leaky gut. This in turn fuels systemic inflammation and can reduce the effectiveness of treatments, creating a vicious cycle of toxicity. So what are some of the key physical consequences of oncology treatments on gut health? Well, we just talked about leaky gut, where there's damage to the intestinal lining, the mucus layer creating gaps between cells that allow bacteria and their toxic products such as lipopolysaccharides to escape from the gut and into the bloodstream. Then there's the gut microbiome dysbiosis or imbalance, in that treatment can significantly reduce microbial diversity and deplete beneficial bacteria, the bacteria that produce butyrate, like fecal bacterium or bifidobacterium, while increasing pathogenic bacteria, for example, like Enterobacteriaceae, which accelerate the mucosal damage. So you basically have a very negative feedback loop. There are systemic consequences to this. The translocation of toxins and bacteria into the blood drives inflammation, leading to severe side effects, which can include neutropenic fever, fatigue, anxiety, as well as depression. This then has an impact on the efficacy of the treatment. A dysbiosis has been linked to reduced efficacy of immunotherapies and chemotherapies, in some cases contributing to severe treatment resistance. In the image that I'm showing from a paper, this shows this effect for acute myeloid lymphoma chemotherapy with methotrexate. The disappearance of the good bacteria that produce butyrate that feeds the gut cells and the increase in pathogenic bacteria like E. coli not only leads to gut inflammation, shown by the lipopolysaccharides in brown, and leaky gut, but drives chemoresistance through drug metabolism shifts, immune system dysfunction, where the leaky gut leads to T cell exhaustion and decreased autophagy of the cancer cells, and metabolite shifts with acetate, you can see in blue, accumulating that increase AML cell survival and may cause relapse of the cancer. Typical side effects to also note that many of you are probably unfortunately familiar with include nausea and vomiting. This affects up to 80% of patients due to damage to the gut lining and the digestive tract, or diarrhea and constipation because of the disruption of normal cell growth and the gut flora, which often results in or alternates between these two conditions. Mucositis, which is the painful inflammation of or ulcers in the mouth, throat, and intestines, as well as nutritional issues, because now if you've lost your gut microbiome and your digestion and ability to produce vitamins is disrupted, including loss of appetite, taste changes, and difficulty swallowing, this may lead to the weight loss that is usual with a lot of oncology treatments. The long-term effects also need to be considered because if there is increased intestinal wall permeability, that can contribute to long-term chronic inflammation even after the oncology treatment is finished. The key here is to eat small, frequent meals, high in fiber, stay hydrated, but report severe diarrhea or vomiting immediately to your medical team. Probiotics are being studied and may help manage certain side effects like diarrhea and abdominal pain, but their overall use requires a lot of caution. And it is crucial to consult your oncologist before using any probiotic supplement, as they can have variable and potentially harmful effects depending on the specific cancer type and treatment regimen, especially with certain immunotherapies or in immunocompromised patients. So probiotics have a large risk. Some of these risks during cancer treatment includes interference with the immunotherapy. There is some evidence, particularly in melanoma patients receiving anti-PD-1 checkpoint inhibitors, that over-the-counter probiotic supplements may be associated with a poor response and a lower gut microbiome diversity. The risk of infection, because cancer treatments often compromise the immune system, like neutropenia, there's a small risk that live bacteria or yeast in probiotics can make it through the leaky gut barrier and cause serious infections like bacteremia or fungemia, especially things like Saccharomyces boulardii. Strain specificity. So that brings me to the effects of specific probiotics that are highly strain specific. A strain that is beneficial in the context of a more healthy gut may be ineffective or even more harmful in the context of cancer therapy. Most studies rely on specific strains under clinical supervision, which is very different from using commercially available supplements. So again, be very, very careful. And finally, there's a lack of regulation. Probiotic supplements are not strictly regulated by the FDA, meaning the quality, contents, and viability can vary widely. And so you have to be very careful and always consult your medical team before using probiotics. So what we'll talk about now is, okay, well, if I can't use a probiotic, well, I can use a prebiotic, and that prebiotic will then help protect my gut lining and will help shift my gut in the favor of beneficial bacteria. But again, before using this specific gut barrier supplement, because it contains glutamine, which is an amino acid that fortifies the tight junctions between gut cells, and which is really good for gut barrier integrity. Again, that's the case in a very healthy gut or an eczema-like gut, but if you have a very dysbiotic, damaged gut from the chemotherapy, you again have to be careful. So just check and let your medical team know that this contains L-glutamine. Basically what prebiotics do during cancer treatment is, again, they can help alleviate these symptoms like the diarrhea, and potentially enhance the efficacy of certain therapies, according to emerging research. However, again, before incorporating them into your diet, it's really important to note that individual responses can change from person to person, and that, again, depending on the type of cancer treatment that you're getting, it needs careful management to make sure none of the other components in there, some cancer treatments, the oncologist doesn't want you to be using or eating antioxidants too much. So it just depends on the type of cancer you have and the type of cancer treatment that you're undergoing. Let's just quickly go through some of the key actives in this product. So basically, they're little pouches. They come in a box. This is a 30-day supply. And you can, if you scroll all the way to the bottom, you can basically see it in the middle of the bottom row. They basically contain resistant potato starch from Ireland. Actually, it's made in Canada in a very pure form. And it's a probiotic that actually boosts certain beneficial gut flora, the bifidobacterium and the Akkermansia. The Akkermansia are kind of like the guardians of your mucus. And as we talked about, your mucus is one of the first thing that goes during oncology therapy. And so this is to really produce butyrate, to, again, feed your gut cells so that they're healthy and they remain tight so you don't have the leaky gut, as well as the Akkermansia, so that you have that whole chain of the butyrate producing bacteria. It also has chicory root, which was very used in traditional Irish medicine. And these are the large chain sugars, the oligosaccharides, that again boost the beneficial gut bacteria and decrease what's called the Firmicutes bacteroides ratio. This is a ratio between two different kinds of bacteria in your gut that actually also helps preventing things like obesity, but more importantly, you want the good bacteria versus the gut bacteria to be in a certain kind of close to healthy ratio. A very important ingredient in this is marshmallow root, again from Irish medicine. The Irish used the marshmallow plant a lot, including the flowers, the roots. This is soluble fiber and has antioxidants, but this basically coats the mucous membranes to support your gut flora. So again, we're trying to produce that mucus layer, which during chemotherapies we saw gets really, really, really thin. And then there's Aronia berry pomace, which are soluble and insoluble fibers that, again, they increase that diversity, that genetic richness of the gut microbiome. You want to keep that diversity, especially, again, these butyrate producing bacteria. So these are basically the 4 key actives for gut integrity and microbiome diversity. And then we've added some superfoods for gut inflammation, to keep the gut inflammation down, and general motility, because a lot of people get digestive issues, including constipation. And so it's to keep things moving. So here we also included artichoke, which helps stimulate your bile flow. So for anyone who already started the process with a little bit of irritable bowel syndrome, we basically wanted to alleviate some of those symptoms. Pomegranate, which has great antioxidant polyphenols, but essentially the key here is ellagic acid in the pomegranate is used by gut bacteria to synthesize urolithin A. And that basically supports gut cell mitochondrial function. So mitochondria are basically the energy factories in your gut. And so this is to really keep your gut working and healthy and active for the digestion. And then ginger here helps protect gastric function, so gut emptying. And it also helps increase the protective prostaglandins in the gut wall. So again, to protect that gut wall. And then there's a kind of big mix of various other antioxidants, including quercetin, acai, camu-camu, mangosteen, etc. And what this powder looks like. So basically it's 1 pouch a day, really easy to use. Take a glass of water. You would normally take this with food. Doesn't matter what time of day. Consistency is good, but not necessary. And then you basically rip open your pouch, You put it into the glass, and it's flavored with blueberry. You can see, again, there's no additional color additives, so it's kind of this pinkish, purplish mix. And then you basically go ahead and drink. So very, very simple. Pretty much, again, double check everything here with your medical team. These products are highly functional, but we want to make absolutely sure that it's not going to interfere with your treatment in any way. Want to thank all of you for attending. Remind everybody of the discount, basically the Cancer 25, which is 25% off any product, which is good through Sunday, this Sunday, March 15th at midnight. And also, if you want to see this again or you want to share it with friends, this will be posted on the Codex Labs YouTube channel. So thank you very, very much for joining us. I hope you've learned something, and we look forward to seeing you at the next live. We have different topics on acne, eczema, rosacea, oncology treatments, etc., menopause. So we're looking forward to seeing you again. All right, take care and have a good evening. Stay safe and good health to everyone.